So rheumatoid arthritis is an extremely common condition. I've seen many, many, many individuals with rheumatoid arthritis. Some of the things that are important with rheumatoid arthritis is that it typically is symmetrical. So typically it affects both knees or both hips or both shoulders, not just one side, which is how osteoarthritis typically presents. And so when a person comes in and they've got this joint pain that is fairly consistently in the same joints, it's consistently symmetrical, it typically is only affecting 2 or 3 joints at any given time, not sort of throughout the whole body. If somebody has all of those hallmarks, then I'm certainly investigating rheumatoid arthritis. It's also very common for me to see people after they've been diagnosed with rheumatoid arthritis. And so, again, sort of with the hallmarks of autoimmune disease, rheumatoid arthritis has very, very much that inflammatory and immune-driven inflammatory component to it, and is extremely, extremely diet sensitive. Rheumatoid arthritis, almost more than any other autoimmune disease, is extremely affected by what we eat, and dialing in what does that mean for each unique patient, because there is no one right diet that all autoimmune patients require. It's about what does your body react to and how does your body propagate that inflammatory cycle. And then of course working with natural anti-inflammatories to reduce the need for pharmaceutical anti-inflammatories. There's a time and a place for everything, but if I can reduce the amount that's needed, or if I can delay the time to start some of the medications for this, then that's definitely a goal of mine. With rheumatoid arthritis, of course, there's 2 sets of rheumatoid arthritis. There's a juvenile onset rheumatoid arthritis, which happens very young, often in children, often in young teenagers, so 13, 14, again, puberty being a major hormonal shift. And that I've seen both in men and women, or boys and girls. In general, there is a disproportionate amount of women who experience autoimmune disease, and girls as well, to men. And I suspect that may have something to do with a bit of a protective effect of testosterone on the immune system. But there is this disproportionate amount of women. The other type of rheumatoid arthritis is typically coming on in that 40-something women category, and with the major hormonal changes or major stressors that are happening with women in their 40s. Interestingly, rheumatoid arthritis is one of these conditions that has an extremely strong stress trigger. A lot of people who develop rheumatoid arthritis, the hormones play a role. However, the stressors seem to be an even larger factor in terms of initiating that inflammatory cycle. And so whether it's a car accident, whether it's a major breakup or a trauma that's happening in a person's life, even a major surgery, so a physical trauma could certainly create that initiating cycle for rheumatoid arthritis.